Thank you very much, dear Chair, dear Commissioner Thierry Breton, Secretary of State, Navarro Rios. The world of work is rapidly changing as a result of technological progress and digital transition, and the development of artificial intelligence and of different forms of work have many benefits, but we have to treat them carefully because they come up with other challenges for the future. We have seen that we already have profound implications for occupational safety and health, including for mental health at work. Our workers who suffer from mental health problems at work is growing. EU OSHA reports that 45% of employed persons are exposed to risk factors that can adversely affect mental well-being. This means that almost half of our working people are facing difficulties. And of course, this has been exacerbated by the COVID pandemics. This discussion is extending to broader implications of work-related stress and psychological risk. These consequences can result in adverse factors such as diminished job satisfaction, increased conflicts, decreased productivity, burnout, absenteeism, and high turnover rates. The labour market as a whole is affected. And we are right now in a situation where we need a functional labour market. We have an important shortage in terms of skills, an important mismatch. We need to address accordingly the needs of the labour market. Parliament's recent research shows significant cross-country disparities in the exposure of workers to psychosocial risk factors and in the ways member states are addressing these issues. It is clear that we have unequal legal protection for workers and access to preventive care of good quality across the EU. So the question is, what can we do to address these challenges? On the 7th of June, the Commission presented a communication on a comprehensive approach to mental health that recognises the impact of work environments on workers' health. The initiative is a long-awaited starting point to address mental health. However, we have to be more ambitious. Given all the above, the Employment and Social Affairs Committee of the European Parliament and the European Parliament as such, we are inquiring, first, which legislative actions will the Commission undertake to reduce harmful psychosocial risk factors at work? Second, if social partners do not find an agreement, will the Commission commit with the legislation to establish minimum requirements for teleworking and ensure the right to disconnect for workers? This is a Parliament initiative. This is very important for us and for the European citizen, and we need to be sure that there will be a follow-up from the Commission on that. Third, will the Commission consider the following legislative actions or initiatives? For example, a legislative framework specifically aimed at preventing and addressing psychosocial risks to safeguard the mental health in the workplace for all workers across the EU. As well, very important, a legislative initiative maybe on AI in the workplace to ensure appropriate protection of workers' rights and well-being. And certainly, we should actually have a debate about the revision of the Framework Directive that dates from 1989 to take into account the new developments of the labour market characterised by increased psychosocial risk, fragmented workplaces and work organisation changes. There are also non-legislative actions and very important actions that the Commission may do, and the Parliament is therefore asking what are such initiatives. First, to promote a collective approach that includes social partners and robust collective bargaining agreements to prevent mental disorders at work, to update the 2003 recommendation on the European schedule for occupational diseases to include mental health issues such as depression, burnout, anxiety, and stress. And indeed, this recommendation, we need to transform it into a directive that specifies a basic list of occupational diseases and sets out minimum requirements for their recognition and compensation criteria. We are right now at the end of this legislature. We still have a couple of months. What is important for the Parliament is to leave a legacy and have this important input for the future work programme of the Commission. Therefore, this is why we have this oral question that we would like to address on this very, very important issue, mental health at work. And I would like to conclude by calling for more ambition to keep our workers' mental health safe and ensure a digital and technological progress that is mostly bringing benefits to the EU. Thank you very much.
Many of us in this chamber have discussed at length the plight of people living in the silent pandemic that is our mental health crisis. While the EU institutions have been more open to discussing the stigma and discrimination faced by people, thanks to the Commissioner Kyriakides in her department's communication prioritising sound mental health for all, but are we doing enough? Harrowing statistics outlined by leading agencies like the WHO, UNICEF, Mental Health Europe are telling us how they are screaming at us that people's mental health is getting worse, drastically worse. We live in a European Union where death by suicide is a leading cause of death for our young people. We need more horizontal planning and funding. The Commission has the responsibility to examine all relevant possibilities to this approach, irrespective of EU competency, and we must urgently create an EU mental health strategy that works for all. Shifting focus to EU workplaces, rapid technological advancements, environmental and societal changes, and sadly, threats of terrorist attacks and raging wars are affecting and damaging the ability of people to cope. Reports tell us that 50% of European workers identify stress that is so common that it is contributing to over half of the absenteeism in our workplaces. Therefore, mental health must be included in the Occupational Health and Safety Directive. You'll hear other colleagues call for this. Good mental health and well-being at work is fundamental to ensuring quality of life for every worker and their family, because we take our mental health home and we take it to the workplace, as well as positive economic outcomes for society as a whole. Only by firmly placing psychosocial aspects of work at the heart of the new EU Occupational Health and Safety Framework will we really create tangible benefits that will impact workers and their families right across our European Union. Thank you very, very much.
Thank you very much, President, Commissioner. Mental health has been the subject of debate on numerous occasions in this chamber, and the increase in mental health disease due to digitalization, precarious labor conditions overall. We've called upon the Commission to deal with this particular issue, health in the digital working world. We've called for community legislation in order to deal with this scourge. Now, there is great discrepancy between the member states and the national legislation. It doesn't work very well. The European Union has to improve the situation overall. Also, to put together a directive for the prevention of psychosocial diseases at workplace. There are other legislative texts which ought to emphasize this particular problem. For example, measures to regulate AI in places of work, and a directive to recognize mental health disease and occupational diseases as well. I'm sure that with regard to mental health, there is the will on the part of the institutions to work on this. 15 days ago, and as a priority under the Spanish presidency, the PEPSCO committee called upon the Commission to look very carefully at this particular problem. And the Commission already began in June focus program, if you like, on this particular issue at the European Union level. But there are still no concrete legislative measures that have been adopted. So I invite the Commission to work on this, to go further, and to promote legislation, to legislate on this particular work and disconnection, and all of the consequences of this as far as mental health is concerned. We've called from the Parliament for legislation to be adopted and to be initiated. The right exists. It is in the treaties, and among social rights is protection of health, mental health, above all, and not only. Thank you.
Thank you, President. Commissioner, with the help of software, your boss can know exactly how many emails you send, how many keystrokes you make per hour, even where your gaze is fixed or whether you're moving through a warehouse fast enough. The promise of technology at work was that it was going to make our work easier and more fun, and it would free us from boring administration or dull, repetitive tasks. Instead, algorithmic management is being used by bosses to treat people like robots. With new technologies, managers can constantly surveil people, micromanage their teams, and put their people under huge pressure. And this constant stress and loss of autonomy impacts workers' mental health and increases the risks of burnout. The rapid development of new technologies will only increase this if we do not set strong rules now. We are working on an important first step with the regulation of algorithmic management for platform work. But the use of technology at work is a problem for warehouse workers, office workers, and workers across the board too. And where the AI Act sets a horizontal legal framework on how these systems can be ethically designed, we now need EU rules on how these systems can be ethically used at work. Because at work specifically, there's a total imbalance of power. So we cannot simply rely on consenting to algorithmic management or the processing of your data. People need to be protected at work. So we need to set strong rules and clear limits to how these systems can be used on the work floor. So, dear Commissioner, I've been asking for these rules since our work on the IDA committee with the majority of the Parliament. And I'm happy to hear you are closely monitoring this. But when will the Commission present legislation for the use of technology at work? Thank you.
O relatório do Parlamento Europeu sobre a saúde mental no mundo do trabalho mostrou.
Thank you very much. This oral question on mental health at work has come at a very important time. We know that many workers suffer from stress and a number of different mental health pressures, and therefore it is important that we address these issues and try to do what we can to improve their experience both at the place of work and more widely. A number of the platforms have a very adverse impact on the workers because they're not properly regulated. This is something which we have to address as a matter of priority. It's not something which can be left to individual companies. What we have adopted in the Parliament is actually a challenge to the Commission, which therefore needs to take some action. It needs to approve some legislation at a number of different levels to protect mental health of workers, whether they're working from home, or working via platforms, or working in any other sphere which is technology-based. We need much more commitment from the European institutions, but over and above that, we need a clear response from the Commission to the demands that we've made, that the legislation be approved and implemented. We need enforcement of the rules that we have, and we need to have a much better approach for the workers. Thank you.
Thank you, Chair, and I welcome this debate on mental health in the workplace. It's a time of unprecedented advancements in science and technology, which we're told will improve the work-life balance for workers and families. Regrettably, the reality falls far short of the promise. The extent of mental health challenges within the EU is alarmingly significant. It's particularly pronounced amongst younger generations, grappling with distinct and increasingly severe difficulties, particularly in housing and the escalating cost of living crisis. Eurostat reports that a staggering 68% of people aged 25 to 29 in Ireland still live at home, 26% higher than the EU average. The lack of home ownership, financial insecurity and accelerated automation in our daily lives takes a toll on the mental well-being of our workers and families. We must tackle these issues comprehensively. As legislators, we must confront the rising cost of living, alleviate the housing crisis and institute policies that safeguard workers from workplace-related impacts such as AI and teleworking that can affect their mental health. Gurmai Give Galer.